first of all, we looked at whether we could measure this concept of prodromal phase in MS using our healthcare data. And in short, we have found that, and combined with others, that around 5 to 10 years before MS onset, people were more likely to visit a physician, be hospitalized, or fill a prescription at an outpatient or community pharmacy. And that the closer you got to MS onset, the rates of hospitalizations and physician visits and prescriptions filled really started to increase. So just to give you an example of what we've been finding in Canada, for in the year before MS onset, we find 78% higher rate of hospitalizations for our MS cases relative to a matched cohort without MS. 88% higher rate of physician visits, again in the year before MS onset, and 49% relative increase in prescription numbers. So, of course, it begs the question, why? Why are these people accessing the health system before MS onset? And in short, we find a high psychiatric burden in the prodromal phase of MS. For example, we find 50% more visits to psychiatrists, 50% more visits to any kind of physician for depression and anxiety-related issues. So what else do we find in this prodromal phase? Well, myself and others have found many elements higher for our MS cases relative to controls in the 5 to 10 years before MS onset. For example, we find more visits to the physician for things like irritable bowel syndrome. We also find more prescriptions filled for drugs to treat gastrointestinal issues. We find more visits to the urologist, more pain, more fibromyalgia, more headaches, migraine, sleep disturbances, more visits to a dermatologist. So as you can imagine, there's a huge range of issues here. None of these features are specific to MS, and many of them are very common in the general population as well. It's nice to see others, not just us in Canada, have examined their healthcare data, and using primary care records or visits to the general practitioner in the UK, they observed similar findings to us, and they were able to look back 10 years before an MS record.